Mhm.
Good morning, and thank you for joining us with Morning Coffee with Gale and Janet. Let's talk health and Medicare. My name is Gail Lawrence. I'm your host this morning, along with my co-host Janet and Yesenia, and we're here to give you information on health care. In these times that we are living in now, it's real important that you have health care. So we have answers to your health care needs. And if you want to do a one-on-one with us, you can always reach us on our voice and text mail number, which is 817-381-1500. Again, that's 817-381-1500. So let's begin this talk with Janet about our health care.
Good morning, everyone. We will begin talking about healthcare, like Ms. Carr said. Healthcare usually begins around for the enrollment period in November 1st. There is a special enrollment period like during these times. Now, for the special enrollment period, to qualify for it, you either have to lose coverage within the next 60 days or have lost coverage in the past 60 days. Something else that could qualify for special enrollment period is if you got married, had a baby, gained a dependent, if you were denied Medicaid, if you had a change in immigration status, or if you got divorced and or legally separated and that's how you lost your health coverage. Now, the following things that we would need in order to apply for the healthcare is your full name, your social security number, your date of birth. This is for those that are under the age of 65. We will also need your address and the county you live in, your phone number, email if you have one, number of people on your tax return, your yearly adjusted gross income, employment name, along with that address and phone number of the employment. And now if you're self-employed, we would need the type of job that you work in. Now, if you don't qualify for this health coverage, we have a plan that we can put you in until you're able to be on the full plan during the enrollment period in November. You can give us a call at 817-381-1500. Again, 817-381-1500. And you can leave your name and email and we will get back to you as soon as possible. Now, for those that are turning 65, Ms. Gale actually has some really great information for you. Ms. Gale?
Thank you, Janet. Okay, so now we're going to talk about Medicare. Medicare for those that are 65 and older. So when we're talking about the Medicare, we want to go back to our school days and look at these blocks, the A, B, C, and D's. And Medicare consists of the Part A and the Part B. And these play a real important part. And Medicare is available to those that turning 65, and there are some other situations where you can qualify for Medicare. Again, when you're turning 65, 3 months before your birthday, the month of your birthday, and 3 months after your birthday, you qualify for Medicare, and it's real important that you get it in a timely manner to make sure that you don't have any penalties. Also, if you've been on disability for 2 years, you'll qualify for Medicare. And some people that have some chronic diseases, chronic conditions such as end-stage renal disease, Lou Gehrig's disease, and a couple of more, you can qualify for Medicare. Now, when we talk about the A's, the different parts of Medicare, the A stands for, I say anywhere that you lay your head. That's what A pays for. The hospital, hospice, nursing home, home health care, all that is paid for with Part A. Now, you will hear people say that that's free. It is not free. When you work 10 years and they took that money out of your check, that's what you were paying for Part A. Now, Part B pays for your doctors, your tests, any x-rays, durable medical equipment, things like that. That's what Part B pays for. Now, Part B, you do have to pay a premium for that. And sometimes we can assist you financially with paying that premium. Just give us a call. Now, C is not really a part of Medicare, but C is called Medicare Advantage. And with the Medicare Advantage, you have to have Part A and Part B. And most of the Medicare Advantage plans include the next one, D, which is drugs, which is real good. And sometime you can get the drug as a standalone plan, as we'll talk about in the next slide. Okay, when you get on Medicare, you have three choices. You can have regular Medicare, Part A plus B, but you need to pick up a drug plan also, so you can avoid penalties. And second choice, you can have Medicare and a Medicare Supplement or Medicare Gap. That Gap supplement pays the 20%. Medicare pays 80% of necessary coverage, and you pay 20%. But if you have a supplement which has a premium with it, it pays that 20%. But you also still need to pick up a drug plan to avoid penalty. And your third choice is to get on a Medicare Advantage plan. Again, like Medicare Advantage is A plus B equals C. C is Medicare Advantage, and most of the time it includes a drug plan. But as we said, if you do Part 1 Medicare Advantage and you don't get that drug plan within 63 days, you will be paying a penalty for the rest of your life on that. 1% for every month that you could have been in a plan and you were not. If that is your case, give us a call and we can assist you. Medicare plus supplement, again, you need to pick up that drug plan so you don't have that penalty. And Medicare Advantage, which most of the time includes your drug plan. Now, if you are turning 65 or if you're on disability or it's close to your birthday or is it time for you to get on the plan and you do not have your card, you don't go to Medicare to get it, you go to the Social Security. So you go to ssa.gov and you can apply to get your card there. If you need some assistance on that, just give us a call at our voice and text mail number, which is 817-381-1500. At this time, if you have any questions, Yesenia, do we have any questions in the chat room?
No, ma'am.
Okay, again, we want to thank you for joining us this morning, and we're here every Monday morning from 9:15 to 9:30 to ask your question. If there's a particular subject that you want us to talk about on this chat, just give us a call and let us know. Or if you need to talk to us one-on-one, call us at our voice and text mail number, which is 817-381-1500. Thank you and have a blessed day.